Hello, everybody. I'm John Archibald with AL.com, and I've been covering the coronavirus like everyone. And one of the disturbing things that has come out of this is a realization, rip the Band-Aid off some of the problems that we've had, and it's become obvious that it's been a real racial disparity when it comes to sickness and deaths. And for instance, Alabama has 27% Black population and 45% at the moment deaths from coronavirus. Nationally, the same thing is true with a population of about 13% Black. Recent study just said that many as 60% of counties that are largely Black are leading the country in deaths. I've got a couple of people here. Uche Bean, the city of Birmingham, who is an advocate for civil rights and human rights, and a strong voice, and Dr. Robert White at Alabama State University, who's a political scientist and a thinker. And you might not be able to see his video, but his audio is strong and his voice is as well. What I'd like to ask the two of you, I'd like to ask both of you to answer this. I'll start with Uche, please. How did we get here to a point in time where
one, John, thank you for having me. To answer your question, I think we got here because history has set the stage. We know of the history of African Americans in this country. Unfortunately, began in a brutal and dehumanizing. Had to deal with what that has caused, the results of slavery. And then post-slavery, we had Jim Crow put a foot on the neck of African Americans. And yes, a portion of that has also spilled over into just communities of created in our communities, especially during this time. So this is historical.
Robert, Dr. White? Of I wrote a bit about the racial disparity. So let's get specific here about the ways in which African Americans, we'll get specifically in Alabama, since we're in Alabama talking, et cetera. What are those ways, Uche? You're on mute, I believe. When it comes to the disparity and how politics and history have helped to aid that.
As Dr. White mentioned, we have healthy food issues, accessibility. It's very common knowledge, not just in deserts. And it almost seems somewhat intentional. And so when we're talking about the immune system, studies have shown, obviously that COVID-19 are pre-existing health conditions. We're talking about immune systems, how our immune systems built to be able to fight this virus, right? And so if we're not eating healthy, if we don't have access, we are feeding our immune systems, then there's no way that we're going to be set to fight something like this.
Dr. White, a lot of people will automatically say circumstances.
experiment. And then you have Marion J. Sims, the so-called father of modern gynecology, who performed the everyday experience that African Americans have when they interact with doctors, healthcare professionals, hospitals, and the state and county when it comes to health issues. And see, I was involved in government even when I was in my teens. I got started early. One of the things that I have noticed when it comes to expanding Medicare, Medicaid, and health related policies, it is almost an across the board negation of any. And so when our governors began to develop this policy of not expanding Medicare and Medicaid, knowing that the same population that is being desperately and negatively impacted by everything else, including Corona, will also lack the health care and the insurance necessary. Bean said, if I could refer to her, Sister Bean, as stated earlier, is that all of these things are culminating because of the historic vulnerability that Black people have. And we'll talk about another vulnerable group, hopefully in just a minute, but the sustained efforts to maintain that Jim Crow system under the guise of the political policy not to expand institutions and the Black community, which oftentimes end up supporting those same institutions.
Ms. Bean, I would point out first before we go forward that we still have a statue of Dr. Sims there outside the Alabama State Capitol, which is an affront to many in the white experience through Corona and maybe before. Is that a reason why we sometimes have difficulty having this conversation?
The encounters with African Americans and Black folks in medical care with the Henry was used to save millions of people coming from a Black woman and her family going without not only recognition, harsh way, ironically by a white woman, right? And even encountering not just the Tuskegee experience, but polio. There's just a history. I've experienced it in Alabama while I was on Medicaid as a young mother, where doctors are not listening to us. So in reference to the Black versus white experience, I think that what we're dealing with is something that is also just a stigma, right? So we're not given an opportunity by your bootstraps. Well, if I don't have boots to begin with, then how will I lift myself up? And so when you can't identify with that, then you lack the empathy to begin a lack of privilege. I don't understand, how certain people are living. And that's also a rich versus poor conversation. And it just so happens that I grew up without a lot of money. I grew up as a Black woman in Alabama, and that's what I was faced with. So my experience is plainly from what I just so happened to go to school with, and I was privileged enough to go to school with them, but I also saw my experiencing being much different than theirs. Being told by my family that I would have to work 10 times harder. So I'm not ashamed of that experience, but it's a reality. And unless people are willing to acknowledge that people of color overall, and specifically Black people in this country, are dealing with issues that other people can't identify.
Yourself up by your bootstraps. And Lord knows I've heard a lot of that in the last few days from people who are resistant to the ideas that you guys are both talking about. But what, Dr. White, you have personal responsibility for what you eat. What do you say to those people?
Right. Well, I would say to them, just look at the billions of dollars that are spent marketing trash food. I would say, look at and Google the deliberate attempt by the food that is sold to people in one demographic versus that of the other. And let me tell you what we're not trying to do. We're not trying to gain a certain public opinion. No, neither am I, and I can't speak for Sister Bean, but now is how do we address vulnerability? Had to intercede on behalf of several people who were just treated downright nasty and wrong by hospitals. And if there is this type of treatment at this level, how high up does this attitude go? System, if you want to call it that. And I will say, yes, it is. Black people's health is just not an issue because you can die of a corona like symptom. Not necessarily corona pathologists that have said that this thing has been around a long time. Just when certain people catch it, they call it. They have to criticize and scrutinize those things because they'll say things like a pneumonia-like symptom. Well, a pneumonia-like doctors and nurses and nurse practitioners that can prescribe things. So I know personally of someone who was a member of my church, 3 different urgent care places because she did not fit the criteria could have killed her. But because she was not considered to be a high-risk person, people are telling you, well, in order for her to get care, you have to lie. Well, now you have to be dishonest. So now you have people telling people to be dishonest, and as everybody else, regardless of whether you have insurance or not. Now, don't have health care, who don't have access to medical assistance will infect people who do, because we're all in this together. And hopefully when we get a chance can read, if they do read, that will give them a great idea of what to expect. 2 books by Ayn Rand. One is called Atlas Shrugged, and the other is Fountainhead. It was a novel written by Albert Camus, the French existentialist author, one of the best books ever published, called Amour. And that town, the different sentiments in the 1941. But he talks about how, it fits bill for bill how America, issue that the book touches on, which will kill us all.
John, we spoke to this. I think the first step is awareness and acknowledgement. Country and the history of both Black and brown folks in this country has been absolutely less than perfect. And we acknowledge that those people that are now aware and educated and are acknowledging it are going to move towards policy and laws and things that are going to change how this nation deals with Black folks and with brown folks. Then, and to celebrate history that has continued to put people down. We can't continue to deny that there are differences in healthcare, differences in every aspect of life. And people are continuously denying it. And I think that the deniability is a safe place for people to be, right? I think that some people get worried that if you ignite, so I'm not going to blame anybody for their ancestors' actions, right? As if I wouldn't want anyone to blame me for anyone that, may not have the privileges that you do, because you see that there's a problem. Vote in those interests, vote in the interest of your children, whole entire state's health and this country's health as a whole.
So it does seem like anybody who's paid attention should have known all along, but because of this sort of awareness, if it's even true that we're increasing awareness, does that eventually?
Well, Dr. White, yeah, go ahead, Dr. White. You speak on it. I'm piggybacking.
Well, one, responsibility, because one of the things that we do not want to do, and that's why, like I said, we're not arguing from a point of weakness. We're not out is to be what Albert Camus in his book, The Plague, talked about, is that the only way to end a plague and the day-to-day decisions that they're making. And this is the question for our Governor Kay Ivey, for Dale Marsh, for population might drop dead. And I could have done something to save it, but I didn't. The people who need it. And so in understanding that, we have to go back to, I'm not making a speech, I'm not doing that the founding fathers of this country were terrible to exert and exercise tyranny. And it is my opinion that it is tyrannous culture has been totally neglectful in enforcing the decent work without making it a policy to wear a mask. That's immoral. And that is showing a weakness to a level that will ultimately lead upset with people who don't wear condoms when they have sex. When you have, you see the moral standards don't match. They don't mix. And so intentional in identifying what people's responsibility is and move from there.
Uche, bring us home.
Move positively forward. And I'm very hopeful of that, and I'm very thankful of that. You know, everything is in total affecting us as a country. Those people that are going back to work front line, you know, they didn't have the opportunity to work from home as in this country. And now, as I said previously, they're just being exacerbated by this virus. Be empathetic and be human and consider everyone as a human first. You know, we are in a place where the administration is not evidence. And my hope is that that will change. And we are also looking at an opportunity for putting them forward. We're not Black people, because Black people were not considered, you know, humans. There were things like this are going to continue. We're going to continue to repeat history, and we're going to continue to be tragically affected.
I was pleased to see that you didn't. I think that you're absolutely right. If we might come a long way if we just start to acknowledge that not everybody is in the circumstance we're in. And
John, can I ask you a question?
Sure.
Can I ask you a question?
Refresh my memory.
Okay. Well, I wasn't born then, and I don't think you were either. And it's updated from time to time. Now, in 2010, that's why I'm talking like this, but it gives a protocol to remove that. It is written in the regs, in the Alabama state regs, that when ventilators get low, you know what the criteria is for that, and who sign and whose responsibility it is to determine who's not worthy to be on a ventilator. See, African Americans were bringing up during slavery and after are still present. Actually become a darn republic and drop this corporate welfare state that we're in, that the people will do. I can't tell you what to do, John, but I can say this. That's one heck of an article. And there are some attorneys that are going to file a lawsuit. What we know as being one of the most unconstitutional administrative procedures acts, people know that, one, we're not stupid, we're not running, we're not afraid, and we are willing to face these issues head on.
Sounds good. Suit has been filed, and it's absurd on its face. So I want to thank you both.